In this video, we're going to go over the parts of Medicare, what they are, how they work together, what you need to know, and what you really don't need to know about them. This is one of the more common questions people ask, one of the more common searches on Google for general Medicare information. So there are four core parts of Medicare. There's Part A, B, C, and D. That's not the whole Medicare picture, but those are the things that are defined as parts. So let's get into it. Part A is hospital coverage or inpatient coverage. So think of it as room and board at a hospital if you happen to be admitted to a hospital. Also pays for the services of the nurses and the staff at the hospital. It also covers, to a degree, skilled nursing care. So facilities, think of it that way. So kind of the more intensive needs for healthcare, Part A covers that. Part B is outpatient coverage. The official Medicare term is medical insurance. That doesn't really specify much, but that's just what it is. So think of it as doctors' offices, the services of doctors, lab tests, routine things, probably what you're using more of throughout the year, healthcare services wise. So Part A and Part B, as you can imagine, you join those together, that's pretty much comprehensive medical coverage, right? And that is true. The combination of Part A and Part B is called original Medicare, sometimes called traditional Medicare. And back in the day when Medicare was first introduced in the mid-60s, that was pretty much what Medicare was. And it was enough back then, but it's not the case anymore. Prescription drugs, for instance, are a huge part of anyone's healthcare regimen, for better or worse. So anyway, Part A and Part B, original Medicare. Something unique about Part A and Part B is it's insured by the U.S. government. Quite literally, your health insurance company is the U.S. government. So keep that in mind. Part A and Part B, that's your foundational coverage. And you need to have that in place, both together, to really unlock the rest of Medicare, choose the other options you have, and complete your coverage. Because Part A and Part B, like I mentioned, anymore, it's not enough. So you're going to need to supplement it with some other plans. So that's where the other parts of Medicare come in. So around the early mid-2000s, there was this phase called Medicare modernization. And again, prescription drugs became a huge part of pretty much everyone's care, again, for better or worse, and the expenses for that were getting pretty high. They're getting higher and higher every year. So there needed to be some form of prescription drug coverage introduced, because believe it or not, there was none before with just Medicare. And then there also needed to be some more affordable options for more comprehensive coverage for folks, just to kind of bring it into the 21st century. So that's where Part C and Part D came in. Part C is just another term for Medicare Advantage. And no doubt you have heard of these. Most every Medicare-related commercial or piece of marketing mail that you get has to do with Medicare Advantage. And it would follow logically that, okay, I got Part A, I got Part B, now I need Part C, right? Well, not necessarily. It is an option. You do not have to take Part C. In fact, Part C is an instead of option. You trade in Part A and Part B to get Part C if you would like to do that. And that's one of the two main options you have for Medicare coverage. Part C plans also, most of the time, include Part D prescription drug benefits. And so that's the fourth part of Medicare, D for drugs. That's the easy one to remember. So basically, those are the four components. There is a fifth component that I would argue deserves to be talked about in here, and that's Medicare supplements or Medigap plans. It's as important as the other four parts, and it fits together in a way I'll explain right now. So there are no quizzes, there are no tests, there will not be an exam about whether you know what the parts of Medicare are. Now that you know it, let's talk about how to actually apply that. So forget what each part means. What you're going to want to focus on, and how I think about Medicare, is just think about what end result coverage you want. What coverage are you going to end up with? You got to assemble the parts of Medicare to your liking to get full comprehensive health insurance coverage that we're all used to. So there are two options for that. The first option is to keep original Medicare, that's Part A and Part B, and then beef it up with a Medicare supplement and a Part D prescription drug plan. And so what that gets you, that end result, is you get all the benefits of original Medicare, which is no network restrictions. You can see 99% of any doctor, hospital, facility in the US that accepts Medicare. Again, it's 99% of providers. And you're going to have a very low out-of-pocket cost exposure, paying as you go. So let's say you land in the hospital, you have $1 million in claims. You're only paying a couple $100, as long as everything is covered under Medicare, which in most cases it would be. So super low cost exposure, ultimate choice in where you get your health care. That's fantastic. And the prescription drug bit, you tack on a Part D plan for a minimal cost each month, you're good to go. That's the more expensive but more comprehensive of the two options. The second option is to trade in original Medicare for Medicare Advantage. And again, Medicare Advantage most of the time includes Part D prescription drug benefits. So it's kind of an all-in-one thing. Sounds nice. That part is convenient, but a couple of things. The one pro is it's less expensive per month. Okay, and for a lot of people, that is a key difference and is the difference, and it's a clear choice. The cons of Medicare Advantage are network restrictions. Okay, so you're going to have to, or it's in your best interest to, and I would implore you to stick to the plan's network. So these plans are HMOs and PPOs. More often than not, they are PPOs nowadays, which gives you more flexibility, but you want to make sure your doctors, your facilities are in the plan's network that you choose. And that can be a bit of a pain and a little bit restrictive if, say, you travel a lot. Another thing about Medicare Advantage that's a con is you're going to pay more as you go, as you use services throughout the year. So your out-of-pocket maximum, which is just a fancy way of insurance term of what is your cost exposure for your share of costs that you would pay along with the plan, that's going to be much higher, into the thousands of dollars, up to $8,000-9,000 a year. So, you get what you pay for. It's lower for the plan itself on a monthly cost basis, but your cost exposure, should something happen and you rack up a lot of claims, you're going to be on the hook for more of that cost as you go along, and it's more restrictive. Prior authorizations are also a thing with Medicare Advantage. So basically that means, if a doctor says, hey, let's go get this scan, I recommend that, then the insurance company is going to insert themselves and maybe say, maybe not so fast, let's do a more cost-effective way, like maybe some physical therapy before we do this more invasive procedure or something like that. And a lot of people don't like that. It's becoming less common, less of a pain, but it is very much a factor. So those are the two core choices for Medicare plans. That's how I like to think of it. Do you want to go the supplement route or do you want to go the Advantage route? All right, so that's the parts of Medicare and how to apply them. Hope that was helpful. We'll see you in the next video.